Hello everybody, my name is Yulia McKenna and I'm here today to talk to you about my Capstone project, which is entitled Restorative Practices and the Development of the Practitioner's New Sense of Self. One of the most profound ideas or concepts I have learned during my first IRP class was provided by Dr. Barbara Filagi, where the simple idea was that becoming restorative starts with us and more specifically within us. This concept was expanded during other IIRP courses where I have learned about other mythologies, approaches, or frameworks such as compassionate witnessing, narrative therapy, social emotional learning, life space crisis intervention, as well as trauma-informed care. This idea prompted me to continuously reflect on practitioners' identity, specifically in a way how, by engaging in the restorative work, we are able to transform or gain a new understanding of self. Another reason for choosing this topic for my project was that there is a little or limited information is provided on how RP affects practitioners themselves and how developing of a new sense of self may contribute to a more effective restorative implementation and sustainability. Although there are many modalities that may contribute to the developing of personal sense of agency, this paper mainly concentrates on such themes as self-compassion, active listening, self-narratives, and motivational interviewing. Parker Palmer once said, "Good teaching cannot be reduced to technique. Good teaching comes from the identity and integrity of the teacher." Therefore, the main idea in this project is that by improving skills that are pointed toward inner selves first, we can become more effective practitioners and offer the world the very highest quality of support. The first modality that this project explores is self-compassion. Many restorative practitioners co-explore the pain and suffering of others, and as a result, we begin to experience them as if they were our own. Over time, these experiences may have negative effects and implications for the quality of our practice as well as our well-being. Kristen Neff, one of the world's leading experts on self-compassion, reminds us that nurturing and amplifying self-compassion skills that are directly to the inner processes may help us to replace destructive self-judgment with self-kindness and allow us to see our personal suffering as a collective human experience. It helps us to eliminate feelings of isolation, approach our negative thoughts and emotions with active awareness, and to diminish negative attitudes towards others, therefore increasing intrapersonal and intrapersonal care. The second modality that is explored in this project is listening. One of the profound elements of restorative practices is the amount of listening that happens during circles, conferences. Active listening is restorative at its core, where it explores the issues first, thus preventing negative outcomes. Yet without being conscious of our inner voice or self-talk, it is difficult to improve our listening ability. By engaging in intrapersonal listening or intrapersonal communication, we become more attuned with our own positive and negative habits that are barriers to good listening. Listening to how we talk to ourselves can be helpful in understanding how we can relate to ourselves, or how do we relate to ourselves, and also to others. It is important that we develop an understanding of how we listen to our emotional feelings and some comprehension of how we listen to our thoughts. Paying attention to our thoughts and actions can bring them into line with the way we want to perform and help us to be more effective in personal and professional encounters. The next portion of this paper concentrates on narrative approach its importance, and how we can overcome some barriers in our practice. Narrative processes emphasize the core principle of the restorative practices of separating the problem from the individual, and rejects an idea of locating a problem within an individual. As White and Epsom, the founders of narrative therapy, point out that the practitioners don't see or understand any dysfunction as a cause of behavior, yet they concentrate on how individuals organize the events that happened in their lives into stories, and then how these stories determine their actions. As a result, the practitioners look and listen to alternate stories and unique outcomes that can widen our narrow perspectives, bringing awareness to our personal qualities and capabilities that were not visible to us before. For a restorative practitioner who often strives to implement RP with fidelity, it is necessary to acquire that awareness and understanding of our own narratives and learn how to deconstruct our personal self-defeating and self-limiting factors. Only then we can accurately and effectively externalize the problems not only of our own but others. All in all, this awareness and understanding of our own narratives and our ability of externalizing may have a profound effect on how we are to objectify and separate the problems from the individuals. The last concept in this project is motivational interviewing strategies and how they may contribute to our renewed sense of self of the practitioner. Motivational interviewing is another framework that is closely related and shared similar goals with restorative practices. Rolnick and Miller, the founders of this model, highlight that MI is a person-centered and strength-based approach and fosters the development of healthy inter and intra-relationships. It is about meeting the clients where they are, supporting individual autonomy, as well as personal motivation for change of behaviors in a safe and nurturing setting. It is about exploring and resolving any ambivalence that a person may have and reducing reluctance for making any changes that we may have. The theoretical foundation of MI lies in the knowledge that people often modify their behaviors as a result of their interaction with others or social environment. Restorative setting provides with that opportunity, where the practitioner may also become skillful in their own processes of eliciting change in their behaviors, thinking, and approaches. As a result, we can see more clearly the discrepancy between our own behavior and the goals we set for ourselves and others. What is equally important that MI supports the development of empathetic understanding through reflexive listening that usually clarifies our own presentation or understanding of reality. As a result, it helps to reframe our thoughts in a healthier direction. Applying skills in self-compassion, understanding of our narratives, enhancing our active listening to our internal voices and self-talk, as well as motivational skills for our own internal change, can help facilitating a deeper exploration of our invincible, suppressed, and repressed internal narratives, and to recognize the innate biases or preconceived notions. It can effectively increase our own self-empowerment and self-awareness. By analyzing the effects RP has on practitioners, we can better understand how practitioners, we, can improve ourselves and increase our professional efficacy and overall improve the field of restorative practices. Thank you.